if we can come to order, I appreciate everybody coming today, and I just sort of wanted to make an announcement. Today we're supposed to hear from Veterans Affairs and Behavioral Health. And there have been so many questions regarding behavioral health and the changes that are going back in behavioral health that we can only today take up the budget for behavioral health, and we will be scheduling a hearing to hear from constituents, advocates, and from the department regarding the concerns about the changes that are taking place in behavioral health. But we've just got to stick to the budget today. But we will be sending out notices of when we will have it next week. We will be having a hearing regarding behavioral health. So if any of you came to testify regarding behavioral health, we're going to stick strictly to the budget, and we will give you plenty of notice so you can come and voice your concerns next week. Thank you. And first we want to take up Veterans Affairs. And the longest serving commissioner in the United States, Commissioner Wheeler, glad to have you here today.
I don't know. Yeah, it's working now. Good. You ready?
Yes, go ahead, please.
Madam Chairman and members of the Human Resources Subcommittee, it's an honor and a pleasure to appear before you this afternoon for the purpose of discussing the amended fiscal year 2011 budget for the Department of Veterans Service as recommended by Governor Deal. We appreciate the support you have given our department, and we understand the need. We all have to work within the limited funding available to the state of Georgia, and we believe that we are doing our part to make that happen. The governor's recommended budget before you represents a reduction in state funding for our department from the funding approved in the continuing fiscal year 2011 budget approved in the 2010 legislative session. We are comfortable with the budget recommendations for the remainder of 2011, and we seek your support of them. However, we have some concerns about the impacts these recommendations will have on our operations. We will discuss those with you so you may have a clearer picture of our operations and how we have had to adjust with doing more with less. We believe you will be able to continue. We really believe that we'll be able to continue to operate our programs in an orderly way, orderly manner under the recommended budget. Mr. Dan Holtz, our Assistant Commissioner for Administration, Health, and Memorials, will make the more detailed presentation of the recommended budget for fiscal year 2011 and changes in it. Mr. Tom Cook, our Assistant Commissioner for Field Operations and Claims, is here to respond to any questions you may have concerning our Veterans Benefits Program and the assistance we make available to the over 773,000 veterans now living in Georgia. As we have talked about this before, this past year, we are extremely proud that our field offices in operation and working together with the VA has brought over $3 billion in VA funding to Georgia's economy, largely through the assistance of the Department of Veterans Service. Ms. Reen Loftus, our budget specialist, and is here, and we'll address any detailed questions you may have about our support operations. At this time, I'd like to call on Mr. Dan Holtz, our Assistant Commissioner for Administration, Health, and Memorials. Dan.
Thank you, Commissioner. Madam Chairman, members of the committee, it's good to be here with you. You've got a copy of the briefing slides, and we do have them up so that you can look at them on the screen. Wanted to just quickly take you through what we're all about. As the Commissioner mentioned, there are 773,000 veterans in the state of Georgia, and our first mission is to assist them obtaining compensation, pension, and the services from the U.S. Department of Veterans Affairs. We provide nursing home care to veteran patients at our 2 nursing homes in Augusta and Milledgeville, and we provide memorial benefits to Georgia's veterans who serve faithfully and honorably in the armed forces at our 2 state veterans cemeteries in Glenville and Milledgeville, which are shrines to the memory of our state's veterans. Our vision is that we will provide the highest quality of assistance to Georgia's veterans in getting their benefits to which they are entitled. We'll provide the highest quality of nursing home services to our veteran patients, and the VA reviews us, the state Office of Regulatory Services reviews us, and also other accrediting agencies, and that's how we can verify what level of quality care that we are providing. And we will provide shrine standard services at our state veterans cemeteries. We value the service of Georgia's veterans have provided our nation and our state and the armed forces of our country, and that they have aided in sustaining the freedoms that we all enjoy because of that service. We value the ongoing partnership our state has with the VA to provide assistance and service to Georgia's veterans and their families. We have 5 programs in our department, and in priority order, they are veterans benefits, our state homes, our state cemeteries, our support services through our administration program, and then we also have the Veterans Education and Training Program, which is the state approving agency, which is a 100% federally funded operation and approves VA education and training programs in the state of Georgia. Overall, our budget on a total perspective is going up slightly when you add in the federal funds that come into our department. But on the state level, which is what we're most concerned about here, our budget is going down from $21,182,680 to $20,961,228, and we'll go into all the details on that in just a moment. Our first program, and I'm doing these by program order so that they follow the tracking sheet. The first program is administration. We've got a change in there of $61,326 involving state funds. Mostly is related to the effect of the furloughs that we took as part of the 4% withhold that was directed by the Governor's Office of Planning and Budget. Also in this program, we've delayed filling 2 positions, and we have reduced workers' compensation and telecommunications that are included in that figure. Our concern here is that with the delayed filling of the 2 positions, the service that we provide to our portion of our department that's in the field at the homes is suffering to some extent, and certainly with the furloughs, every employee in the department is taking 1 furlough day a month, and that is having an impact. The other funds number, that $159 that you see there, apparently that was a statewide change from DOAS in unemployment, and that was the impact that it had on our department, which basically is not a problem for us. In more detail, the next slide shows each of the line items that are in the budget, and you can see they're all reductions there, and they are addressed in terms of their description and what they are, where they came from. The funds for personal services that $52,239 that's shown there is a reflection of the actions that we took to comply with the 4% withhold. The next program is our state veteran cemeteries. We've got an adjustment there of $24,372, which will drop that state funding level down to $518,461. Again, the majority of that is related to furloughs. That has had a little bit of an impact on some scheduling of interments. Has not been significant, but we have had to make some adjustments because we didn't have staff readily available to do the interments like we would normally do Monday through Friday. Like I say, it was just a minimal adjustment, but nonetheless some. The remaining portion of that relates again to workers' compensation and telecommunications. And the detail is on the next slide, and it's broken out for you there. The next program is the Augusta Nursing Home. The adjustment there, $253,561 as a negative on state funds. That same number is a positive on federal. And what's going on here is this past year, the VA changed the regulations on how reimbursements are handled, specifically for veteran patients who are 70% disabled. The VA now pays the full cost of care for those veteran patients. So what this is an offset of state dollars that we had been spending that addressed those patients, and recognizing that that same amount of money is now going to be coming from the federal government as part of the total cost of care. So it's, in essence, a zero net-sum game. And the same thing you're going to see when we get to the Milledgeville slides in just a moment. In essence, the impact on both of the homes for this change in payment is, in essence, negative. The extent of the federal funds that will be coming in is directly related to the number of those 70% veteran patients that we have in the home at any one time. At the Milledgeville Nursing Home, we've got a plus-up situation. This adjustment is related largely to a one-time cost settlement that was related to what was going on down there. What we had was last year we had two actions that we took centrally. One, to fund a negative fund balance that we had on our books that the auditors took exception to and said we had to get rid of. And so we had to fund that out of last year's operating funds. And then we withheld some money in anticipation of budget reductions. And unfortunately, those two actions did not get translated into a contract amendment. And so we were withholding the money, the services were provided, and so we had to get the contractor paid. And we settled that for the total of $761,582, which OPB recognized as a need to fund because we would probably, well, I know we would have a reduction in patient care of probably somewhere between 25 and 50 patients per day if we didn't get those funds put back in.
Well, I think we've got some questions on that. I don't really understand. Run that one by me again. I don't understand that.
Okay. We had a total of $761,582 that should have been paid to the contractor last fiscal year.
Construction contractor?
No, ma'am. The contractor operator of the Milledgeville Veterans Home. Pruitt.
Okay, so y'all owed them $761,000.
Correct.
Last year.
Yes, ma'am. And we didn't realize until after the end of the fiscal year that those dollars had not been paid to them, and that they had provided the services, and that we owed them those dollars. It was a one-time situation, and we recognized what happened after we discovered it, and we've taken action to make sure that it doesn't happen again.
Representative Oliver.
Forgive me for not remembering enough, so my question comes out of a little bit of a gap in my historical.
Okay.
I was aware that Pruitt was the contractor to run that particular nursing home, and I assume the contract's based on a per diem rate?
Yes, ma'am, it is.
And how long is the contract good for?
Well, it's a 1-year contract, renewable 4 times, so it's a 5-year cycle.
And the per diem rate is what?
$160.42.
And there was a miscalculation in that, or does the contract provide for additional services that were not accounted for?
There was a miscalculation on our part, and by that I mean we had to fund the negative fund balance that occurred in the department's audit report that was related to when the state converted to programmatic budgeting. There were a number of transactions that had been put into the system prior to that conversion, and when the auditors applied the programmatic requirements to everything that we had done, and they went back basically 20 years, there was a negative fund balance there.
In the state audit department, negative fund balance was where?
They determined that we had a negative fund balance on our books for our department, and that we had to clear that off. And the only way that we could do that was to set aside money in fiscal year 10, last fiscal year, and have that money returned to the Treasury at the end of the fiscal year, which is what we did. Now, at the same time, when we were all going through the exercise of the budget reductions, we set aside money at both homes to fund a reduction that we anticipated would be coming our way. That wasn't a problem at Augusta because it's a state agency, and we just reduced the appropriation that we sent them. What should have happened at Milledgeville was we should have amended the contract that we were withholding money to fund that negative fund balance and to fund the budget withholding.
What I think you're telling me, correct me if I'm wrong, is that you knew you owed $761,000 back to the state treasury, and you were going to acquire that money by not paying Pruitt.
The full amount, the full 761 was not back to the state treasury. It was about 250 of that was the negative fund balance.
And so you were going to save that money from your ongoing budget in the latter part of FY10 by not paying Pruitt.
That's correct.
Did Pruitt agree to that?
Ultimately, they did, but it was after we realized that we had not amended the contract as we should have.
And the contract is based on $161 a day, and there aren't any other extras that go up and down on that contract?
No.
Okay.
And that's a full-service contract. That includes room and board, physician service.
What is the Medicare rate, daily rate, for nursing homes that Pruitt, the Medicaid daily rate for nursing homes that Pruitt operates?
I don't have the exact number, but I think the Medicaid rate is somewhere around 136 to 140 something.
Less than your
yes.
rate.
But the Medicaid rate does not, that is paid to Pruitt, does not include the physician services. And the physician services are included in the per diem rate that we have at the state veterans homes. That's one of the requirements of that program by the VA.
And those physicians are not reimbursed in
That's
addition
correct.
by Medicare or Medicaid
That's
or any
correct.
other private insurance program?
That's correct.
Okay.
What about when a veteran goes to a hospital and you have to see it? I mean, maybe you want somebody to Oconee Regional Hospital. Who pays that cost?
That is the responsibility of the veteran. And so if they're eligible for Medicare, they can file under Medicare. If they're eligible for VA medical benefits, the VA will pay for that hospitalization. Some of them have some private insurance. Not very many, but a few of them do. And the private insurance will cover them. But that's a service that is outside the nursing home, and the way the program's defined is that $160.42 pays for the care and services that are provided at the nursing home. But that includes the physicians, includes the physician assistants, includes the meals, includes all the nursing care and everything, social services, rehabilitation that goes on, etc. All of that's covered under that rate.
Representative Sassler.
Thank you, Madam Chairman. What would you say the root cause was of the $761,000? Was it a miscalculation of days and full-time equivalent, patient days you've got? I mean, was it? How do you, in a relatively simple accounting scheme, how do you miss that?
It was a misunderstanding on the part of the division director who operates out of Milledgeville that he needed to amend the contract, and he didn't do it.
I apologize. I'm just trying to understand that, and you might have made it clear to Representative Oliver. And I'm perhaps the slower kid in the class here. I just feel like I've got an obligation to understand this, and I don't yet. But the amending of the contract would be based on services rendered that had not yet been paid for. There had to be some kind of there had to be services moving forward for a certain number of patients, with the expectation from the department that fewer patients were being served. There had to be.
That's what should have happened. Yes. When we determined what the amount of money was that we were going to withhold to cover the negative fund balance and the anticipated budget reductions. And we had that number, and we provided that number. What should have happened was the contract should have been amended to reduce those funds, and then the number of patient days associated with that would have been reduced.
So if this legislature, it passes on reductions to you, the only mechanism you've got, you can't pass those reductions onto your contractor on a daily basis. The only alternative you have is to reduce the days of patient care.
Yes, sir.
That's the only variable.
That's right.
So, looking back, what specifically should you have done? Should you have said, "Hey, budget cuts are here. We need to reduce our head count by X," and the head count was not reduced by X? Is that what?
Yes, sir.
How many full-time equivalents would 761,000 be for a year?
It's somewhere between 25 and 50, depending on what you calculate as the daily rate. At the time, the daily rate was $85 and some change. I forget the exact pennies. And that would have reduced the number of patients by about 25 patients per day.
Now, the $85 per day compares to what? Is that an apples-to-apples comparison to $160 a day?
Well, that was at the time, that was the state portion of the $160.42.
I see.
We have since adjusted that state portion because there's been a rule change on the part of the VA as to how much they're going to pay. And the daily rate now for the state is $81.71. So it's come down a little bit.
Okay. Have you guys done a root cause analysis of how you made that error? Is that something that you wouldn't make again because you've solved the accounting problem?
Yes, sir. We know what happened, we know why it happened, and we know that it's not going to happen again. We've clearly addressed that issue. The people involved know where the mistake that they made was, and it won't happen again.
Representative Oliver.
I think the mistake was made between Veterans Administration and the state. That was the root mistake. And then there was a consequence of y'all making a determination how you were going to pay it to Pruitt. So your question, first question about where was the mistake, was, I want to make sure that I'm understanding it correct, was really when you were short of money, it was because of y'all's accounting between veterans and the state, and then the accounting issue with Pruitt was a consequence of you needing to find the money. Is that correct?
I wasn't clear.
Okay.
Okay. The first problem was at our level. Right.
Between
that
you and
in-
the state.
Right, between us, the auditors, OPB, what have you, that we had to fund, first of all, the negative fund balance. We had to fund that.
You had to pay back some money.
Had to pay back some
And
money.
then the only way you could get money was to either reduce your population dramatically or pay them Pruitt less, and you made a decision to pay them less for a period of time, and then you had to repay them.
Yes.
Okay.
Yeah, because we should have by contract reduced the census up front, and we didn't. That's where the mistake was.
Costly mistake, wasn't it?
Yes, ma'am, it was.
Representative Manning.
I want to be clear. I think the difference between 48 and 48.3 and 48.4 is the fact that 48.3 is a state agency and 48.4 is a state contract. Is that correct?
Yes. Yes.
Okay. At what point did the contractor give you notice that you owed them money?
In June of last year.
And did they send you a statement, or did they just say, I mean, you know, when you send a bill for $700,000, I think that's a little hefty of a just here's an invoice. I'm not clear as to how they justified that under the present contract that you negotiated.
The process that we went through was rather convoluted. And I hate to point fingers, but you asked me a question, so I'm going to answer it. There was a problem on Pruitt's side. They thought we owed them $1.4 million, and contacted us and said, we need our $1.4 million. And we said, no, we don't owe you $1.4 million. We've paid you everything that we owe you. And after we reconciled on their books and our books what they had been paid and what we had paid them, is when we fully realized that we had withheld money from them that we should have paid them to the tune of $761,000. And it was at that point in time, in consultation with the law department, negotiation with Pruitt, that we realized that we owed them that money, and we determined that that was what the exact money was that was owed, and we agreed to that amount to pay them.
May I follow up, please, Madam Chair?
Yes, go ahead.
On your slide presentation, on the one that's entitled 48.4, when it comes down to your summary of stuff, you said that the state funds were 8.5 and federal funds were 8.1. I was under the impression that this Milledgeville unit was not a Medicaid facility.
That's correct. It's not.
So how does it get Medicaid money?
It doesn't.
Did we have this discussion the last time that we had this, that we were going to ask you to look into perhaps applying for those
We
funds?
did.
What was the outcome of
The
that?
outcome of that was the study concluded that Medicare and Medicaid money was not a good source of funding because there weren't that many veterans who were eligible for Medicaid because of their income status. And the Medicare dollars are very episodic. They are associated with hospitalizations. And if the veteran is not hospitalized, you can't get Medicare dollars. And even when
is this not qualified as a nursing home?
It is.
I guess I'm a little confused then at how that, maybe you can get with me later, I'm sorry.
And I think if we can, if we sort of we maybe need to have a few questions about the report. We've had a lot of people that have reviewed the report that had some questions and some concerns, and so maybe we can schedule something. And I haven't had a chance. I got 5 copies of the report, but I haven't had a chance to give it to everybody for them to review. So why don't we schedule a hearing and we'll review that report and talk about that report at a later date, if that's fine with you. Those are very good questions. Any other questions regarding this? Go ahead, then. Thank you.
We'll move on. Our next program is our Veterans Benefits Program. And this is where our field operations and claims function resides. Again, it's our largest program in terms of staff, and so the state fund reductions that you see there for $394,754, a lot of that is directly related to furloughs and position vacancies that are associated with the 4% withhold. Also, we've had, as part of that 4% withhold activity, we have held 6 positions open department-wide, and for most of this period of time since that withhold was put into place, 4 of them have been in the veterans benefits area. So that has had an impact on our ability to provide assistance to veterans in terms of filing claims. And of course the balance of it is the workers' compensation. The negative on the next line, total federal funds, if you'll go to the next slide, our 100% funded Veterans Education and Training Division participated in the furloughs, and so there was a $19,500 reduction in federal funds that will be coming in that's associated with the furloughs the Veterans Education and Training Division took. And that basically concludes our presentation.
So let me get this straight. I keep on going back to this 761,000. If we had to put in 761,000 in the amended budget for that era, in the 012 budget, do you take $750,000, reduce it by that much? Since we
That's not in the budget proposal, no, ma'am.
Okay. All right. Okay. Do I have any other questions? Representative Sessler.
Thank you, Madam Chairman. This time last year we had a discussion, I think it was during the, I don't think it was during the amended budget discussion, I think it was during the actual, what would now be the 11 budget. Mm-hmm. You know, we talked about the benefit that I read is about 50% of the funding for the nursing homes come from the state, 50% or plus or minus come from the federal government. Is that basically the balance, more or less?
Yes, sir.
Okay. And I seem to recall the out-of-pocket payment for this, for the veterans that qualify and that are accepted here, is still pretty close to zero. Is that right?
Yes, sir.
Okay. We talked about, you know, the ability to, you know, whether there was an ability to tap into Medicare or other funds. That was complicated. Probably wasn't likely to come together very easily. I know this committee talked about the possibility of moving this towards a sort of fee-for-service facility where some federal funds were pulled down, matched by private individual contributions, where essentially individuals could be phased in to pay the amount of money that's coming out of the state budget. Have you guys done any more looking into that, what that would look like, whether that could be phased, whether there could be a partial payment from individuals? Because again, this seems to be an extraordinarily lucrative benefit for a relatively small number of, I mean, given the 707,000 veterans we have in the state, mm-hmm. you've got, what's your population between Augusta and Milledgeville?
Well, there's today 160 at Augusta and 212 at Milledgeville. That's today. Augusta has been, you may have heard that there is a freeze on admissions at both homes.
Sure. That
freeze has been lifted. And we have given Augusta authority to raise their census up to 170. Now, they're on a 185-bed capacity, so there's still 15 beds that they're not going to be able to fill because we've told them 170 is their max. And that will keep them within budget. They'll be okay. At Milledgeville, we have done the same thing. They were down to 208 just last week, and we've given them authority to go up to 235. That will also stay within the budget. So the freeze is off up to that point. One of the things, and you mentioned the Medicaid Medicare report, and I don't want to go into detail because of what Chairman Housen just said, but one of the things I think that would be good to bring out at this point, the second conclusion of that report was there is VA money out there that these veterans are entitled to that right now we cannot collect because we don't have any authority in Georgia law to collect it. And so the main recommendation that came out of that study was that there be legislation to give the authority to the department to collect the VA money that is available to veterans for health care. It's a benefit primarily that is involving what's called aid and attendance. And it's basically in round numbers, a $20 per day benefit. And we just ran the number up, and if we were able to collect that, we would probably generate something in the neighborhood of $3 million. Now, because of the history that you alluded to about the generous benefit that we have here, where state appropriations and federal per diem payments cover the entire cost of operations, that proposed legislation was set up that it wouldn't be implemented in terms, put it on the books, and then the department would say, okay, when do we implement? Well, the implementation would be when a determination is made by the commissioner and approved by the Veterans Service Board that the state appropriations and the VA per diem payments were not adequate to cover optimal operations. So that's the way we set the legislation up in the proposal. And I might add that we've been in consultation with the governor's office on this, and they have indicated that they do not support the legislation at this point in time.
I'm just trying to understand, you know, when you're, are you at liberty to discuss why that might be the case? Or actually, I don't want to put you on the spot like that. Let me ask you this. What would you see as the benefits of reaching out and getting those $20 per day?
From a personal perspective, and I've been in the healthcare business for all of my career, in essence, one of the things I learned very early on is if I, as a patient, have an investment in my health care, I'm going to be a more responsible consumer of health care. And I think from that standpoint, if there's some ownership that the individual veteran has in the health care he or she is receiving, that is a positive, even for nursing home care. My primary background was hospitals and community health. So I think there's that benefit. Also, the thing that concerns me, again, personally, is that this money from the federal government is there. Every one of our veterans who are admitted to our veterans homes, both of them, are counseled by our field service offices that are located at Milledgeville and in the Augusta home on that benefit, and are all filing applications to receive it. Now, depending on what their income levels are, most of them, if not all of them, are determined to be eligible for the benefit because they're in a nursing home. But the income level, when it kicks in, some of those people who are quote-unquote eligible are not able to receive the cash benefit because they're over income. And part of the reason they're over income is they're not paying anything for their health care. And when we kind of ran the numbers, one of the things we tried to look at was if we started to charge a fee or a copay, some more of those people who are eligible but because of income are not receiving the cash benefit would begin receiving the cash benefit.
So there would seem to be a double advantage to doing it.
Yeah. And like I say, right now, the ones who are, because of their income, receiving the cash, they get to keep the cash. They can do with that whatever they want, and we have no control over it because we have no ability to collect it.
And the concern I share, and I'll close with this, Madam Chairman, is, as I recall from our conversations last year, there is some additional capacity at one of the homes that's additional wing floor that's not being used.
Yeah.
And to the extent people can, as Governor Perdue was fond of saying, put some skin in the game.
Mm-hmm.
You know, if they're putting some dollars in so that other state dollars could be applied to new, to additional people, for the same out-of-pocket payment for the state, we could cover a much larger population of veterans by making veterans pay some portion of the freight. And I think there was an encouragement from this committee to consider that, and I just would echo that again.
Representative Oliver.
Thank you, Madam Chair. I look forward to an opportunity to discuss your report that I have looked at a little bit and tried to absorb. But one of the interesting things to me is, again, who gets this benefit, which is an enormous financial benefit to the family as well as to the veteran.
Excuse me, which benefit are we?
Of being able to be without any cost.
Okay.
To get a bed.
I just wanted to be sure I understood which one you were referring to.
To get one of the 379 beds at your two facilities. You said that there were 700,000 plus veterans, but the state statute that set up these nursing homes in the 50s limited this opportunity for nursing home bed to wartime veterans
That's
only who were residents of Georgia for 5 years. 5 years. So the 700 plus thousand veterans would be reduced down to, I'm not sure how many at all, would be potentially eligible. 100,000 or 50,000?
No, it's probably closer to 500,000.
From
we've had a lot of veterans
wars.
who, yes, ma'am,
Vietnam,
because
Korea.
the definition of wartime is the obvious ones: World War II, Korea, Vietnam, Persian Gulf I, and of course what we are now going through. But there's also that period from 1955 to 1963 that is defined in Georgia statute as the Cold War. And all of those folks are eligible for admission to a state veterans home.
Well, that answers that question for me then. So it's not a reduced number, essentially, if there's still over 500,000. It's not the benefit or the service that we're providing the veterans without cost to them or their family that concerns me. They've earned a lot. What concerns me is who gets it out of 500,000 people. 379 out of 500,000 people. And that seems a little bit kind of the luck of the draw. And that's what
it's those who have medical need.
Well, there are how many 100,000 people in Georgia nursing homes today?
I don't have that number, but yeah.
Could you tell me how many other veterans we have in nursing homes in Georgia that are not located in the veterans home?
I can't, but I can see if I can get you that information.
I think it would be interesting to know how many veterans we have that are not receiving these benefits.
I know the VA at all three of their medical centers have nursing home beds, and I know the VA has contracted with community nursing homes around the state for some beds.
So we have some veterans that are in private nursing homes that are out.
Right.
And those veterans do or do not have Medicare or Medicaid benefits?
I can't answer that.
I think they do, but
they very well may. I just don't know. But I can try and get you a good ballpark number on how many nursing home beds the VA has in the state.
But, Madam Chairman, I do appreciate the opportunity to really, for me to understand this report. I conceptually understand that not many veterans receiving full VA benefits are going to be income eligible for Medicaid.
Mm-hmm.
But when you put them in a nursing home category of income eligibility, that becomes grayer to me. So I look forward to an opportunity to really understand the report.
We'll try to get some more copies and make sure all the committee has a copy of that report to study and try to set up a time for a hearing next week.
That'd be
That's
fine.
fine with
Yeah,
y'all.
yeah.
And just sort of discuss that next week.
I think Chase can get his hands on
Yeah.
some additional copies if you need
Yeah,
them.
y'all were
because-
real prompt about when I requested some about getting them over
Well,
here. I
and
appreciate
he can download them off of the internet,
All
so.
right. Sounds good. Any other questions regarding veterans benefits? Thank you, and thank you so much for coming.
Thank you.
Thank you.
I don't know how many people had a chance to hear the announcement I said before we started, but we have such a big report on behavioral health benefits that we're going to have to stick to the budget and discuss the budget regarding behavioral health. And we're going to hold a hearing next week so we can hear from providers, consumers, and all interested parties regarding the behavioral health and get some input from the community and from advocates and from the health, behavioral health. But we're going to have to stick strictly to the budget today. But you'll be given further notice of when you can appear. And I'm sorry for this inconvenience. I thought we were going to have a time for everybody to be able to talk, but the budget is so thick, we're going to have to stick to the budget. And there are lots and lots of concerns. And we appreciate y'all, any providers that are here that want to express their opinion, you'll have a chance to next week to have all your concerns answered. Thank you. And Representative Neal, thank you so much for coming. And I want to I'm sorry you missed my early announcement.
I'll be back.
Okay. Thank you. Thank you, Dr. Shep. I don't know if you heard my announcement that we're going to have to stick straight to the budget and any talk, and you can say what you want to about the settlement, but we're not going to have any testimony from other people regarding the changes that are taking place in behavioral health, because it would take so long, because we've got so many people that want to add their concerns from providers. And if it's fine with you, we're going to set up a hearing next week and try to work out some of the problems that we're hearing around the state. I think if everybody's here, Representative Hurd stepped out a minute. Maybe he'll catch up. Did he say anything before he left, Judy? I said we're going to break about 5 minutes, and I think we've probably done 10. And does everybody, have you received a handout regarding the tracking sheet? Does everybody have a tracking sheet? All right, thank you. Go ahead. Thanks.
Very well, I appreciate that, Chairman House. And I'm going to speak really from the tracking sheet that you have, and the slides have simply. No, they're not. I hit the space bar, it didn't work. These slides really are the tracking sheet, but just formatted for PowerPoint, but I'll be speaking from the same information you have. And we'll go program by program, looking at the fiscal year 2011 amended budget request from the Department of Behavioral Health and Developmental Disabilities, beginning with Adult Addictive Services. What we see is really a reclassification of funds as federal in accordance with the State Accounting Office Financial Management Policies and Procedures. This is really an accounting adjustment, a transfer of about $20 million in TANF funding from the classification of other to federal. It does not impact the program or the agency's budget. It's really an accounting move to put the money in the designation from which it actually arises. The next item is Adult Developmental Disability Services. This, again, is a similar accounting adjustment that has no impact on the agency or its budget. It's a transfer of $30.6 million in funding to and some TANF funding from other to federal, again, just identifying the proper source of those funds. The item 15.2.2 is also a restoration of FMAP funding. The enhanced FMAP, as you know, is going away incrementally, and this is a restoration line item that represents that shift to a 31% state match. It's $8 million and $75,000. Item 15.23, this is funding related to the settlement agreement with the U.S. Department of Justice, and it goes to funding mobile crisis and crisis respite homes, $2.4 million, and family supports of about $375,000. The line.
Let me ask a question.
Mm-hmm.
On a mobile crisis team, for how much does it cost to fund one mobile crisis team? What's the average cost for one?
Well, that cost varies depending on the amount of travel, the distances involved, if this is rural versus metropolitan. So the costs fluctuate. The 2.4 million covers how many?
For 3 months funding.
Mm-hmm.
For 6.
For 6 teams. So that's 6 teams, 3 months funding.
16 mobile crisis?
6.
I thought you said 16. I'm sorry.
No, 6.
Okay.
6.
All right. So, and
that's
that's funding from them from, you said 3 months. So when will that be in place?
Some of those are in place now, and there will be one. Yes, we target one for each of the 6 regions, and those will all be in place by July by the end of this fiscal year.
Okay, so the mobile crisis teams that are in place, can you tell me where they are in place?
They're in place in Region 1.
Region 1.
Well, that's adult mental health. These are let's back up. I was confusing the mental health crisis, mobile crisis, with the developmental disabilities, and this is developmental
Okay, this is
disabilities.
developmental disabilities. Okay.
Mhm.
All right.
These are new. These are all new teams.
Okay, these are all new teams. So there are no in developmental disabilities mobile crisis centers up and running. Yeah.
No. Right. The mobile crisis units for developmental disabilities work in conjunction with the crisis respite homes, and these are designed to meet the requirement of the settlement agreement that we not admit individuals with developmental disabilities for temporary and immediate care in state psychiatric hospitals. They will be receiving services in crisis respite settings specifically created and supported to deal with those who are having extreme stress or needs as a result of developmental disabilities, and the mobile crisis will facilitate doing that.
Representative Oliver.
Just so I make sure I understand it, DeKalb County has mobile crisis units and a short-term crisis residential facility. Isn't that accepting both developmentally disabled and mentally ill, or is it only accepting mentally ill?
I believe it's only mentally ill and substance abuse, which
Is there a reason to think that there's going to be a difference in cost between those two categories of impairments? And what is the average cost of the DeKalb mobile crisis unit? I'm not sure I know.
I would have to get back to you on the exact figure for DeKalb. There is a substantial clinical difference between the needs of someone with developmental disabilities versus mental illness. Often the person with developmental disabilities is going to require active behavior plan, from the moment they arrive and throughout their stay and transition back to their community setting. The person with mental illness in crisis is not going to necessarily require the same kind of one-to-one management, depending on their level of need. But
I agree that there's a different clinical portrait. I'm just curious whether there is a difference in that some cost, but what the average cost might be. Are you funding in your settlement new crisis units for mentally ill or only for developmental disability?
this is only for developmental disabilities. This is to meet that one requirement about temporary and immediate care.
And that's relation to the settlement, but other mentally ill people exhibiting crisis-related behavior, there is no mental unit appropriation for them, crisis emotion.
There's one, yes.
Statewide.
Statewide, yes. Incrementally across the settlement to 2015, we will have mobile crisis by 2015 serving all 159 counties.
In the mental illness category.
In mental illness category, and that will be incrementally developed across the time span of the settlement agreement. And currently, there are crisis services for adult mental health,
Like in DeKalb.
like in DeKalb.
And as those mobile units are developed, I assume that's going to relieve some portion of the sheriff's work. Transportation.
Significantly, we're seeing that result in some settings now. Yeah. If I, moving forward, adult forensic services, item 15.3. This is really no change. There's nothing in the amended budget as a new request. For adult mental health services, 15.4, there is no change in that item as well. Going to 15.4.1, we do have a $10.6 million amended request to support various services in requirement of the settlement agreement for fiscal year 2011 towards that 1st July 1 milestone. And these include really an array of commitments for assertive community treatment teams, community service teams, intensive and regular case management, crisis stabilization programs, a supplement to our current crisis line. A portion of this will go to supportive housing and supportive employment, peer support, well, not in this amended, but there will be quality management additions and some transition planning, housing, residential support services, and some of the costs associated with reporting to the Department of Justice about our progress.
Tell us exactly, you said the first benchmark was July 1.
Yes.
What do we have to have done by July 1 exactly?
By July 1, we have to stop admissions for temporary and immediate care on the developmental disability side. We have to have in place 2 new ACT teams, and the procurement for those is already underway.
Is that in developmental disabilities? Or?
No, this is for adult mental health. And 1 CSP, 1 new crisis stabilization program, some enhancements to our crisis line to accommodate that. Right, and on the developmental disability side, the goals are primarily the stopping the TIC admissions, the temporary immediate care admissions, and fulfilling our obligation for 150 developmental disability waivers. There's nothing in the amended request for that because those were already part of our base plan going into 11.
Okay, thank
Those
you.
are already covered.
Representative Manning.
Can you tell me if those are,
Put your mic, we can't hear you.
can you tell me if those are already in place? Do you know where those are? And could we possibly get some list? And are they by regions as well?
We can, you want to go to the next?
You gonna put it up on the screen?
We have,
You're gonna have to bring the screen closer.
do you have a copy?
Do you have a PowerPoint? Do you have a copy of it?
A printed handout of the map.
Of the ones that are in place, not the ones you propose. We want.
We can bring you one of those that are in place.
I think we want to see what's in place right now.
Okay.
You know, if you could bring, well, maybe we can get that information before the hearing of what's in place, not proposed.
We probably
Okay.
need what's proposed too.
Could you please introduce the
Sure. Rick Dunn is my operations chief, and next to him is Lee Wright, who is our chief financial officer. Greg Hoyt is our director of hospital operations.
Thank you. I just had a request to see it. Okay. All right. Representative Manning,
Yes, ma'am.
do you have another question?
No, I'm happy with that.
All right. Thank you. Go ahead. I'm sorry to.
All right. Let's see, 15.4.2 is another FMAP restoration, adding about $1.5 million to restore the incremental change from the falling off of the enhanced FMAP. And this is specifically for adult mental health funds. Item 15.5 is adult nursing home services. There's no new request. There's no amended request for these, so that is a 0. Child and adolescent addictive disease services, 15.6. Similarly, there's no change, no amended request. 15.7, child and adolescent developmental disabilities. Again, there's no amended request. 15.8, child and adolescent forensic services, again, has no amended request. 15.9, child and adolescent mental health services. This is a transfer of state funds related to the transition of child and adolescent programs to community settings from direct care support services to child and adolescent mental health services. This is something that would otherwise be done in fiscal affairs, but it's an accounting move from one program to another as a result of moving out of the child and adolescent inpatient state hospital services. So the money that was previously in those hospital budgets is transferred to community services, which is where those children are being served now. So that's an accounting move. It has no net effect on our budget.
Representative Oliver has a question.
You and I have discussed the agreement you have with DHS where you transfer $30 million plus from their budget to your budget for mental health services for foster care children. Is that where that budget money is, in that line item, 15.9?
15.91 in the, yes, it is. That is correct.
And that sum of money does not include the Medicaid reimbursement for those children that would be in addition to these sums for physician or pharmaceutical or other Medicaid reimbursable care. Am I correct?
I mean, is this all state dollars
Right.
without Medicaid or FMAP enhancement?
Yes. Am I correct?
Yes.
So the actual cost for providing good medical care for these foster care children is $30 million. Mental health, it's a lot, but I'd like to know what that number is. Do you feel like you know what that number is? Because it would be your agency plus Medicaid's agency, I guess.
Well, it would be an appropriation to us in state dollars that would receive a federal match that DCH would draw down for us as a fiscal intermediary, but in a budgetary sense, the money, resides with us as state dollars. So you could take that and multiply it by the match factor and come up with a figure.
But is the match different than the Medicaid reimbursement? Or is it the same thing?
Well, Medicaid reimbursement, to be, I guess, as clear as you can, the language here can get very confusing. Medicaid, if something is being reimbursed by Medicaid,
Fee for service.
fee for service, a dollar is divided into a portion of state funding, and it is, in my way of thinking, matched by federal funding. Others may speak in terms of being paid for by federal funding matched by state funding. So we have to be careful how we use the word match, but essentially 31 cents on the dollar is state money and 69 cents on the dollar is federal money. The legislature, you appropriate state funds to us, the DCH draws down federal matching monies to then pay the provider for the service.
Could you tell us how much total money is going into the program?
Into that DFACS,
Uh-huh.
well, what's appropriated is about $32 million, and if all of that were Medicaid matched, then you would have about $100 million.
Does that answer your question? About $100 million. And that's going to foster children.
We can get you the exact number.
And $100 million is going to foster children for mental health.
Not right. That's why I'm concerned. We probably need to get back to you with specifics on the amount, because not all of that is matched. A lot of that funding will go to non-Medicaid reimbursable services, and that would mitigate that.
I think we'd like to know the total amount that's coming up. Any other questions on this? Go ahead. Representative Oliver, your light's still on. Okay. Thank you. Thanks.
At 15.9.2 is another portion of the FMAP restoration. This is restoring state funds to FY11 from existing waiver services. It's again that 31%, the new state obligation, and it comes to a net of $4.3 million. 15.1 is departmental administration. The first item, 15.1.1, is reclassifying other funds as federal funds. Again, this is an accounting, moving funds from other to federal to recognize more appropriately their origin. And 15.1.2 is an adjustment in anticipation of reduced workers' comp premiums. Our workers' comp claims have gone down. In 15.1.3, this reflects an adjustment in telecommunications expenses. This figure, $339,000, does not fully cover the gap that is created in making us whole against added costs for participating in GATE, the shared services for technology support. And we can get you more detail on that if you're inclined to look at that more closely. 15.1.4 is a transfer of state funds around software licensing. This goes back to the transition from DHR to the new departments, and what was missing in that restructuring last year was funds for software licenses on computers. Comes to $555,000. In 15.1.1, direct care and support services, this represents funds transferred to child and adolescent mental health. This represents those dollars used to support child and adolescent mental health at Atlanta and Central State Hospitals in their respective direct care programs. So again, this goes back to closing the child and adolescent units and moving, transferring those funds to child and adolescent community programs. In 15.1.2, substance abuse prevention, there are no changes, no supplemental requests. 15.13, Georgia Council on Developmental Disabilities. This is a reduction in funds in it's an attached agency, and this is related to their contracting. The last is also an attached agency, the Sexual Offender Review Board, and there's no change or amended requests coming from them. That brings to a final request on the last line is $10,255,000 in total in the amended ask.
Representative Manning.
Mr. Commissioner, back to the 15.13, the reduction of funds for contracts. Can you tell us what kind of reduction? Was it across the board as a percentage, or did you pick some that were just program changes? Or I mean, it's not much money, but what were they?
We're not. We'd have to get back to you on that. That is an attached agency that makes its own presentation, or
so this was part of the budget recommendation, just straight.
Mm-hmm.
The 4%.
Mm-hmm.
Is there anybody with the council that would like to speak with that to that? Representative Manning, do you have another question?
No,
Is
ma'am.
that cleared up? Okay. Do I have any other questions regarding this budget? Representative Garner?
Chairwoman, I wanted to ask you a question about 1510 Ford. Tell me a little bit about the software licensing program that you're using, and is it an eligibility program? Is it a billing program?
These are licenses for basically just Microsoft Office applications on computers. This
So
is
these are for administrative purposes and are not for the eligibility or the... Okay.
no, this is not related to the MMIS or eligibility or any of that. These are regular applications, nothing fancy.
For what you use inter-office to do.
In the offices, and I would say that this is also in hospitals. It's really across services, regional offices. It's just all the Microsoft licensing that was apparently not allocated in the reshuffling of the departments.
Just to make sure I understand, so it's not used for eligibility purposes or
No.
for billing?
No.
No, thank you.
Is this a one-time funding? You said it's for licensing, so you have to renew the license every year?
Right. These are the licenses that Microsoft charges the state. It's in every department, every state agency. Whoever, if you write a document on Microsoft Word or you use an Excel spreadsheet, then you're paying a license fee for that.
Any other questions? If there are no more questions, I think we will just hold them till next week, and we'll get with you about when we'll be having our meeting, so we can hear from providers and consumers and other groups that have some concerns.
Okay?
Thank you.
Very good.